and welcome to today's session of the Natural Birth Summit. Today we're talking about twins and natural birth, and we're talking with Dr. Victoria Flores. Hi.
Hi.
Good to have you on here. Yeah, no, good to have you on. Thank you. Dr. Flores, MD, trained in OBGYN, but found the standard medical approach for birth in a hospital to be lacking in compassion and lacking in trust of natural birth. Dr. Flores tried to find ways to mimic natural birth in the hospital format. But undisturbed birth, in her view, does not exist and will never exist in a hospital. She eventually accepted that and moved on to a new way to support pregnancy and birth. And today she uses her skill in obstetrics to assist women that desire to birth twins and breech-presented babies in the comfort of their home. Water birth has been a part of many of these stories and has given her the opportunity to discover where a birth pool can help and or hinder success in these types of birth. Okay, let's get started. So for a mother expecting twins, what can she expect to be different for a twins birth than a singleton birth?
Great question, Adam. So twins and singleton mamas often, when they're first-time mamas, go into the mystery of labor and delivery, thinking that there are a set standard of stages and phases of each stage. And for the singleton mom, that would be very correct. There is the first stage, the second stage, the third stage. And the first stage is split into two phases, the latent phase and the active phase. Well, right. in a twin birth, you do go through a first stage and a second stage twice. So occasionally, a mom will have to go back into a latent phase of labor before she becomes active again. This is after the second or after the first baby's born and before the labor of the second baby. And then at the very end of repeating those stages, then she goes through the final third stage. And I have mentioned this in other places that there has been one situation that I'd seen a third stage happen before the mother initiated her first stage and second stage, and then third stage again for her second baby. Very, very rare, and it is a complication and isn't something you want to expect, but it can happen.
Okay. So what you were talking about how, I mean, we know that the stages of labor is a model. The model has to change when you're looking at twins. Understand that. What is it that leads many providers to categorize twin births as high risk?
Well, one thing is that every time you add a different potential phase or stage to any situation, the probability of unpredictable things occurring increases. So we easily understand that moms go into labor, they have a baby and they have a placenta. But when you throw the second child into the picture, different things can happen, such as the second baby comes down in a malposition. Okay, well, that's going to change the scenario. How long is it going to take for that baby to get into a position that can reinitiate labor and progress normally? And will it become a situation where that will never occur, which is just something that you can't really think about with a singleton, because in a singleton, if that were to never occur, if someone was in a malposition initially on their admission into a hospital or in their initiation and care into midwifery care for their labor and delivery, then that would be something urgent or emergent, and an abdominal delivery would have to be planned immediately, and it would actually be organized, controlled. But when it happens to the second twin, after a first twin is delivered, you're at home or you're in the middle of labor and you don't have the time to organize that abdominal delivery often, because it's urgent at that point because the mom is exposed, her cervix is opened, her waters have ruptured. She likely has been exposed to the environment for some time. So her risk of increased infection goes up and hemorrhage goes up, and laboring for a longer period of time on a uterus that's already done so much work to push out a first baby can weaken that uterus or can make it more exhausted, is what we say. But those are also funny words to use because the uterus does keep the strength that it needs when it needs it, but it also takes breaks when it needs to. And sometimes those breaks are just not fortunate for the moment to progress according to what we would hope would be a smooth one baby, then another baby.
Right. Okay. Yeah. And what's how does a mother who's expecting twins, can she evaluate those risks, evaluate the what her opportunities are for having an out of hospital birth? How can she look at that in a positive and productive way?
Well, one important thing is the prenatal care period. So things that are more not common, but are more prevalent in a community of women that has twins versus a singleton would be things like anemia, gestational diabetes, hypertension of pregnancy. So pregnancy-induced hypertension and preeclampsia is another way of saying that, as well as other disorders that are associated, cardiac issues, twin-to-twin transfusion syndrome if there's a monochorionic pregnancy. So these types of risk factors can be treated and worked through and found and lead care in the prenatal period. So it's important to get prenatal care when you have twins. I know that sometimes that becomes controversial when someone has something like a di pregnancy, a diamniotic, dichorionic. So they have two amniotic sacs, two placentas. It is essentially like having two babies, completely separate pregnancies in one abdomen. And so it's easy to think that it's going to be just like any other pregnancy. And we try our hardest in this natural birth world to treat that woman that way. But we also have our antenna up for the case that perhaps more fluid is retained that causes more of an anemia, and which degree of that is appropriate in anticipation of increased blood loss during the delivery, which happens much more often in a twin delivery than a singleton, and what is considered abnormal and what is going to cause cardiac strain and what is going to be significant for these twins. So I think prenatal care is a place where people can really nip in the booty some of those risk factors early. And if you really do think about things that early, you can prevent anemia, you can prevent hypertension of pregnancy, you can prevent gestational diabetes with high nutrition and the correct exercise and the right psychological mindset as well, and appropriate respect in your prenatal care. All these things can prevent a number of things that, we just don't talk about in the regular medical model.
And in terms of other preparation for birth, in terms of the way that the twin babies are presenting. I mean, one of the things you might do in late pregnancy, if you are a singleton mom, is you might do some of the things recommended on spinning babies, that kind of approach. Does any of that apply here, or is it just completely different ground?
No, it absolutely applies. I think the point of spinning babies, as well as all body work, is to create a suppleness of the body so that babies can allow for their own shapes and self-held positionings and gravity to find a natural seat in the pelvis. And everyone should have a normal pelvis. In case of a mother with a normal pelvis that hasn't been in a car accident, a crush injury, or some type of surgery in the past that perhaps prevents the movement of bones in a normal, natural way. The pelvis has mobility within its joints. Then yes, opening the abdomen, opening the pelvis, opening the sacrum with inclinations and side lying and all those releases is just creating space for the baby to do the best thing for itself in the pelvis. And more often than not, you're going to get a longitudinal lie of the first twin, which is all you need to begin vaginal labor with a twin pregnancy.
Okay. And how unusual or not, I'm conscious that we're in the hands of, we're talking to you, you're a specialist, a bit of an expert in this field. How likely is any woman, let's say in America, to be able to find a provider to do a twins home birth? I guess it's different if it's your first pregnancy or your second, but how much of a special case are we talking about here in terms of provider availability?
It's very rare. There are a handful of physicians that will do out-of-hospital birth, first of all. And in many of the states, midwives are not allowed to legally attend home births of twins for medical decision-making. So I do have midwives at home births with me, but they're there for neonatal care, because they are the experts in neonatal care, as I am for the labor and delivery aspect. They actually know a lot, and we participate in idea sharing. But legally, I have to say that I am the medical manager. So
of course.
Yes, but okay, other than having a physician at your birth, yes, there are some states in America where there are no laws regarding who can attend a twin home birth. And in those cases, there are midwives that are willing to attend twin home births. It's just kind of an underground market that you need to know people that know people to kind of get so it's not necessarily advertised, right?
a bit of research, a bit of digging is required.
Exactly. And in that case, I would just recommend talking to a local midwife who knows another midwife, and eventually you'll get down to where you got to go with the vetting of those midwives as a cushion, right? So it's just, that would be how you would initiate that discovery.
Yeah.
Yeah. But other than that, twin home births can be done vaginally in a hospital. It's just that in that situation, just like in the UK, I suspect you should be I disagree with this, but in the hospital teaching is that you're in an OR with staff on standby, ready to jump on in and deliver that second twin by abdominal delivery. And it's intimidating. And I mean, having a vaginal delivery in a hospital is exhaustive, first of all, because you have so many strangers that are part of that scenario that you just don't want to be in your birth, right? But then when it comes to the twin birth, I mean, you'll have 20, sometimes up to 30 strangers that are involved in your care and your child's care, children's care, because there's two of them. I mean, it's a lot. So, but yes, you can find vaginal.
Sounds more like a circus than a healthy environment, to be honest.
And sometimes it really is, because most hospitals have some type of student education, and there are people that really aren't useful that are going to be standing around. And it's good for them to learn, yes, but it's hard on the mother who already has to be subjected to so many new faces during a very vulnerable time.
Yeah. Okay. Wow. And what would you? How would you differentiate your approach for a mother for whom this twins pregnancy is their first pregnancy versus their second pregnancy?
Well, I will say there's a lot more success with vaginal delivery of babies, whether or not you're a singleton mama or a twin mama, if you've had one baby prior. So with first-time mamas, we call them primiparous mamas. With a primip is the short, abbreviated version. With a primip mom, it's so new, and the body is really educating itself on how to birth a baby, that not only is there less success with the vaginal delivery of twins in that scenario, but labor is often very long. much longer than a lot of people anticipate. With the singleton, maybe you think 20, 30 hours max, right? You think like that's the worst case scenario. But with twin mommies that are first time, I mean, we get 3-4 day labors. And with minor breaks for sleeping and eating, the body will turn itself off. But then once your brain is kind of on that you're in labor, it's hard to really shut down. So I find that mentally it's a real challenge to first time moms, but a lot of them do it.
It's still possible. Yeah. Yeah.
Oh yeah, absolutely.
Okay. Wow. Okay. And so talk about then what is the difference when you do twins labor, twins birth in water compared to doing on land?
Well, one way that a first-time mama or second-time mama can really help herself through that first stage of labor is to disperse the pain over her body. Maybe it's no longer pain; it's just work and it's pressure and it's heat and when you're in water, whether or not you're first-time mama or a second-time mama, a third or whatever it is, the water really does help distract from the point tenderness that can sometimes be experienced by the laboring mother. And I think that it's just psychologically so much more peaceful to have all the elements of nature around you during a labor. So often we see women lighting candles and they put on some wind chime music and, you know, they have the water and then they also have the fire because they're contracting. So there's so, and then, you know, earth is just your body. So there's, a balancing element that I think that Western medicine has not really utilized in the psyche of the laboring mother that Eastern medicine acknowledges and that I encourage in all of my labors with women. If they can, we can find a way to balance what they need at that time. Let's do it. Yeah. And water is just one of those ways to do it. Yeah. And doulas are great too. I know I didn't get to mention, but whenever you initiate a labor with a doula, and I mean initiate, like not go through 2 to 3 days and then say, now I need a doula to try and get you to the end. I mean, you have a doula on standby for the moment you begin labor. Labor is going to go so much better. And I am not exaggerating when I say that. So water is a way to make labor better on the physical and mental side of things. And so can a doula.
Okay, fantastic. What would you add to in terms of what we talked about? What else would you share that you think is important for mums to think about this time?
Well, you know, I really want people to know that when they have a twin pregnancy and if they want to consider home birth, it is absolutely safe to have a baby underwater if you're a twin mama. And it's in that case, it is like having a singleton, except you're going to just do it twice over. When a mother is having or decides to labor with twins at home and say she successfully delivers or births that first baby and is waiting for that second baby to begin its labor period, whatever it needs to initiate contractions regularly, consistently, strongly, short interval, long duration. Sometimes those mamas do need to get out of the water. So staying in the water seems like maybe a crutch because yes, the first baby came out and it was a lot and it was burning and maybe there's a little bit of blood and maybe a little bit of fear about what's going to happen with that second baby since there is a lot of worry about that second baby. But really what I would recommend is focus on that first baby and make sure that it's doing okay and listen to the people who are with you. And if they recommend that you stand up, get out of the water, maybe move around a little bit, it actually could really help progress to the next part of your labor versus just sitting in place. Yeah, I would say that. I mean, you can always give it a go in the water for that second one. But often once the first baby leaves the abdomen, there's so much room for that second baby that it kind of does a little flinch or flail here and there and can lock itself into a new position that isn't necessarily optimal for another passage through the pelvis. And so you do need to exit the water. And once you exit the water, you can get back in once those contractions become regular again, because that means that your baby did get back into a position that your body wants to continue to push it through the pelvis. Yeah. And there are positions that we use in a birth pool, like a flying cowgirl, where after baby A comes out, you'll see the mom fly on her belly, lift her legs up and hook them behind on the pool, and put her arms in front and hook them on the top of the pool. And she's upside down. And the water's very shallow at that point. You have to have people that can help you take out water, put back in water. I mean, there is a dance when it comes to a birth pool. It's not always, fill it up, warm it up, you gotta go, and then boom, it's done, and then clean up, go, right? And maybe sometimes those really fast deliveries. But for these unique deliveries where things can take time, you need to have, or I would recommend that you have a group of people that are there to help you. And so flying cowgirl is a thing to do after you deliver the first baby. In that case, you'll probably have to cut the cord of the first baby, because you can't really do that with your baby still attached to you. And that's why it's not needed every time. Often the mom's second baby will come down into position and those contractions will hit immediately hard. And no matter what position you're in, that baby's going to come through. But if things stall out, things you can use the birth pool for, flying cowgirl. You could do huge lunges in the birth pool to try and get a few contractions in a deep lunge. And then we have one called Captain Morgan, where you just like stand with one foot hanging over the pool, and it kind of just lifts up and imbalances the pelvis. And an imbalance at this point is good, because you're really trying to shimmy the baby into a position that it likes in order to come down. And that's different than doing things that imbalance the pelvis during the prenatal period before labor has begun. So I just want to make sure I say that.
Okay. Yeah. Distinguish those things. Right. Okay.
Yeah.
Wow. Flying cowgirl. I've not seen that or heard that one before. That's,
Yeah. It's exciting to see. When you see it, you're like, wow, it looks like she's squishing her baby. But she's not. It's kind of just lifting the uterus up and letting that baby slide deeper into the pelvis, like creating a slide. Often after the first baby comes out, the abdomen is very pendulous because it's stretched out for two babies, and that uterus can flop forward, and that doesn't facilitate engagement of the second twin. And so anything you can do to lift and tuck and push down, a little bit of abdominal support with reboso, those types of things, that really helps initiate the labor of the second twin, not just sitting there and letting your pendulous abdomen stay out, because physically it's impossible for the baby to come back in if it's out. And I've actually seen the second baby with a leg hooked over the pubic bone, and there was no way that kid was going to come out unless somebody went and help that baby get its leg back into position, tuck it in, and then come back down. And that was a breech baby. So it literally was sitting on its mother's pubic bone.
Wow.
I know.
And is it, what about the approach to cord clamping for the first baby?
So it depends on the situation. I always work with the goal of keeping everyone whole and without separating the cord. Because if that's my goal, then I'm not going to be cutting it too early. There are times when the cord does have to be cut before both twins are delivered. Then the placenta comes. And in those situations, it's when the cord is too short. And it does happen. And I'll tell you why. It's because if the placenta implants itself to the fundus of the uterus, and the fundus rises with the development of both twins, and then you deliver the first baby, and there's still another baby in there, then that cord is very much doubled back onto itself inside the mother. And so it's very high up. And so it's not that the baby has a short cord, it's just that functionally it looks short on the outside. So until its sister or brother come out. So in those cases, we will wait for the cord to stop pulsing, and we'll ask for permission. And if the mother does want us to continue in the water, often she'll let the cord cutting happen. And if she doesn't, then maybe we would recommend taking out water and letting the baby sit in more of a shallow pool at the perineum of the mother, or just getting out and doing things on land so that there's even less of a risk of the baby submerging itself after it's been delivered. Because once we've organized the heart-lung balance of air use through the lungs, it's not going to go back into fish mode and rely on its umbilical cord once we've opened up those breathing passages. Exactly. So once the baby comes out of the water and stays in water, it likely can do just fine underwater for a good amount of time. But once it's out, we have to treat it as if it belongs in the air.
Yes. Yes. Okay. Fantastic.
Yeah.
Fantastic. That's really a great introduction to this area. What would you say to offer to people to what they can do to continue their research in this area, things that you have, things that they can find elsewhere, and what if they want to follow up with you personally?
Well, I will say that researching breech birth is very important because there are many twin mamas that will have one or the other twin in a breech position. It's just the way they fit together inside of you. Yes, I would say it's more common to have a head down delivery, but still that's only about 40% of all of the combinations. And there's 3 other combinations, or more if you include transverse. So it would be the head down, the head down breech, the breech head down, or the breech. And then hopefully, any of the other ones for the first twin don't happen. But yes, you could have other presentations of the first twin. The second twin's presentation doesn't really matter. It just comes down when it comes down, and the decision will be made at the delivery if it's safe to continue laboring on that twin. Yeah. And so understanding that the second twin is at a higher risk than either a singleton or the first twin that came out. I almost treat the first twin that comes out like it's a singleton, and then the surprises happen for the second twin. And sometimes those surprises can be very dangerous and can lead to bad outcomes, hypoxia, prolonged dystocias, those types of things. And you want someone with you to help you decide if that position for the second twin is safe for you to push through or it needs assistance coming out. And I would say that's just one thing I would hope that people could study is finding somebody who's willing to be with you for that second baby to get into position. Because I also support free birth for moms, but for twins, I would say I would recommend not to do a free birth with twins.
Okay. Yeah, understood. That's great. So breech birth as an area for research to really inform yourself is a good idea. Get that. Okay. And what about your social profile? That's Instagram, I think. Is that right?
Yes,
you want to follow you on Instagram and connect with you that way? Yeah.
So you would go to @Victoria _MD_birthing. MD is in medical doctor. That's the degree we have here. So Victoria _MD_birthing. And I do share a good portion of my twin birth stories, not all of them because they have to have the permission of mom and the pictures that she sends in order for me to post. But a good handful, and even a couple that have been willing to be tagged. So if you do want to communicate with them directly, you can send direct messages and see how they feel. If anybody did want to come into my care from out of state or out of the country, I do have some people that do decide to do that because they're having difficulty wherever they're located finding a provider. That is also something that I can work with, perhaps doing prenatal care outside of my immediate management, and then around your birthing time, coming closer to me, and then we can take care of you postpartum as well. So yeah, those are ways to do it.
That's great. Yeah, lots of options. Well, this has been inspiring as well as informative. It's really appreciate you coming on to share this experience that you gained over the years. So thank you so much for that. And really appreciate that. And Instagram, Victoria _MD_birthing.
Yeah, fantastic. It's the easiest way. Yeah.
Thank you so much. Take care.
Thank you too. Take care. Bye.